Supraventricular tachycardia, or SVT, can show up with a heart rate of 180 beats per minute or higher. It happens when the electrical signal comes from somewhere above the ventricles instead of firing normally from the SA node. The important thing here is that patients with SVT often report vague symptoms, palpitations, and the hallmark sign, a sudden onset. The trigger is usually a rogue cell in the atrial muscle, sparking an erratic contraction or run of them similar to what you'd see in atrial fibrillation or atrial flutter. The thing with SVT is it can stick around until it's treated, or it can be intermittent, coming and going on its own without warning. Now let's zoom in further. Tachycardia just means an abnormally fast heart rate. SVT just tells us that the fast rate is starting above the ventricles. But with that, there are two categories: narrow complex and wide complex. And the distinction comes down to QRS duration. Under 0.012 seconds is narrow, and over 0.12 seconds is wide. This matters because it's an objective measurable clue. It tells you whether the arrhythmia is coming from the atria or the ventricles. And remember, when the rate is too fast for the patient's condition and their heart's ability to keep up, you're typically seeing falling cardiac output, poor oxygenation delivery to the tissue, and a dropping blood pressure. So here's a narrow complex example: sinus tachycardia. The rhythm is regular, the rate is above 100 beats per minute, and every P wave is present and upright, and the PR interval sits between 0.12 and 0.20 seconds. The QRS complex measures 0.6 to 0.11 seconds, with a clean 1-to-1 ratio between P waves and QRS complexes. So why does that matter clinically? The most common drivers of tachycardia are underlying heart disease, electrolyte imbalances, certain medications, low oxygen levels, or another factor pushing the patient towards instability. If they are unstable, rapid treatment has to be started to correct the underlying cause. But keep this in mind: narrow complex tachycardias are far less likely to cause life-threatening instability. In some cases, the rate is actually a normal, appropriate response. The body is needing better circulation from fear or exercise. It can also show up with moderate blood loss affecting circulating volume. If you like this content, follow for more, and see you in the next video.
Integrated, immersive, essential. ACLSMED.com